am Barbara Levin, and I'm co-hosting the second virtual Legal Nurse Consulting Conference with my friend and colleague, Patricia Iyer. Earn CEUs while watching this riveting story, Profits Before Patient Safety, Disaster, with Dr. Kenneth Rothfield, Chief Medical Officer at Texas Health, Arlington Memorial Hospital. He is nationally recognized for his work in patient safety and is currently leading a surgical patient safety group and advancing healthcare culture. As an anesthesiologist, he is also a certified physician executive and holds certification as a certified patient safety professional from the National Patient Safety Foundation. He earned an MBA and a graduate certificate in Business of Medicine from Johns Hopkins University. Welcome.
Hi, Barbara. It's great to see you.
Can you share with us what our audience is going to learn from your program?
Sure. I think by now most people have heard of Dr. Death, Dr. Christopher Duntsch, who is the Texas neurosurgeon who maimed and killed tens of patients. A story that didn't really capture the national attention to that extent is actually much worse, and it's about Dr. Atiq Durrani, who is an orthopedic spine surgeon in the Cincinnati, Ohio area, who currently has hundreds of malpractice cases against him.
And can you explain what type of pearls they'll be taking away? I understand that there will be many aha moments and shocking revelations during your presentation. Can you also share, in addition to that, what types of roles that you see legal nurses could perform in a case such as this?
Sure. I think my talk will be not only about who Dr. Durrani is and what he did, but what about the doctors, nurses, and most importantly, hospital administrators who were complicit in his malpractice? These things don't happen in a vacuum, and surgeons work with teams of people who know that something is wrong but don't speak up. And in this case, Dr. Durrani was the most profitable doctor at a new hospital, and a whole machine was built around him, even though things seemed really wrong. So this is really about what happens when hospital leaders put profits ahead of patients and what ensues. And this is one of the most extreme examples I can think of. It's also about the legal system that is failing to support the hundreds of patients who haven't gotten justice, in this case, many years after they were injured by Dr. Durrani. In terms of the role of legal nurses in a case like this, there's so many things that a legal nurse provides value in terms of not only analyzing medical records, but being able to look at a situation and answer the question, was this environment safe for patients? Because the most important things that we can do as hospital leaders is make sure it's safe not only for patients or staff. Was this an environment where nurses and other medical professionals could speak up? And certainly a legal nurse professional is able to answer that, to kind of zoom up and answer the question, was there a culture of safety at this organization? And is the organization at fault for not providing one?
Yes, that is a very good point that you raise, and certainly I know that you will expand upon that during your program. There are so many other areas for legal nurses. Aside from that, there's those children that were injured and have long-term problems. So there's the life care planner, somebody who can do cost projections, somebody who can evaluate standard of practice. And we look forward to hearing more about your involvement with this matter as well.
Well, thanks, Barbara. I can't wait.
Thank you. We're looking forward to your program. Please join us on October 23, 24, 25, 2020 for our second virtual Legal Nurse Consulting Conference. Please see our website below, LNC.tips/October 2020 virtual. We look forward to seeing you there.
Thanks, Barbara.